One of the biggest problems with the design of health systems in Africa is that they were designed with the idea that the people on the continent are poor, and therefore they cannot afford high quality evidence-based care and services. And so what that did is that it institutionalized a system that I call poor medicine for poor people.
We are again in a very dramatic time. We don't have the virus, but we have a political virus. And this political change completely changes the paradigm of how health systems are financed. That's one thing, and you need more local financing, and you have we all have to do away with this donor-recipient paradigm, which is much outdated. We must certainly also acknowledge the need of external support for a certain period in some areas. But the main change of the mindset is that Africa can do it on its own and will do it on its own. And even in Europe, which is maybe a little bit better off in some areas, we have for decades in the European Union, a mechanism how to support poorer regions from richer regions. Rather than congratulating Trump, I would say never spoil a good crisis, take the best out of it. And more or less, it was a tumbling giant. The post-war system was a tumbling giant. It was already eroding. And now the last knock has brought it to fall down. And that's something which would have happened anyhow at a certain point in time. The way it was done, I think, was completely unacceptable. I have to say that. No government in the Trump administration did proceed in a way which you should never do in international interaction, because it's eroding trust, it's replacing trust by power, and it's creating a brutal speed for some of the adaptations. And I think there are very good numbers that many people died because of that. Full stop. So I can't congratulate anything which leads to the death of many people. I think data now have to be treated very carefully. They are in principle a necessity for the entire world. For instance, if you look at flu vaccination, you need data on the virus variants in Asia to create a proper flu vaccine in Europe or Africa or the US. So we need to share our data globally.